2025. Happy birthday, Jesus. Okay, this is Doc Ellis, your hick doctor.
Happy belated birthday to you.
Oh, yeah, I just turned 84
Oh,
December
yeah.
1st. My Lord have mercy. Okay, Angela, OWCP from Texas. Are you starting to schedule again? We're scheduling all the time. It's just a long time to get in. Now, my doctor sent my cases to last year, October. After October this year, it doesn't matter. And I pray every day I'll get my appointment with Dr. Ellis. Now, first of all, you need to fill out our protocol. If you don't follow the protocol, you don't get in the door. This is legal medicine. It's complicated, and you can't just pick up the phone and go to the dentist's office. Now, federal workers' comp, go to ellisclinic.com. That says protocol. And then you fill out the stuff and put your records together and you send it. If that comes into this office, you'll get a response. Doctor doesn't know. Find out what the doctor says, and then the protocol cover letter. I don't know. My doctor sent this in. You may already have it, so we don't have two charts. Okay, but you should be getting an appointment. And now maybe road number because you guys are just made me too damn popular. Okay, so that's federal. VA disability looks like that when you go to appointments. You got to do that. If you don't do that, you don't get in the door. Okay, because this is our contract. I need to know what you're doing. We're not going to pick up the phone and say, "What do you want?" You list down what you want in VA, and then we'll look at it. And you may have 12. We may only, but we have to have it in writing, and you have to do it, or your veteran service or your doctor. But your doctor cannot make an appointment for you here. You've got to make the appointment. You're asking for Dr. Ellis' service. Your doctor can refer, but you have got to fill out that form. If you don't, we probably don't even know you exist. Right? We're small. We're taking on the whole damn world, and you're going to have skin in the game. We're the cheapest in VA, and most times on federal, we don't even charge you. We think you can win it. Now, things like CA2s that have to be developed, we'll charge you a nominal fee. Then when we get it approved, we refund it. Okay, so fill out the protocol. I mean, you have to do that to go to any other doctor's office. This just is going to have to do more. We need to know, okay, how can I get in contact with you? Go to ellisclinic.com. It's got the phone number. And then if you need an appointment, don't call. Now, if you want us to mail you one of these forms, call. Yeah, we'll be glad to mail it to you. If you don't, if you're in the car, pick up the phone, call, and we'll mail you one. Then you can fill it out at home, or you can print it out. Okay. And if you're an old man like me and you don't have a millennial around there, a grandkid, then we'll mail you the form. Okay. Oh, now here's why is it so difficult? Get a second injury through federal workers' comp. For example, you have carpal tunnel syndrome, a lot bilateral, both hands, afterwards shoulder issues. Yet OWCP denies it. This is the greatest question of all. Then I'm the lone voice of the wilderness. Now, damn it, listen to me. Everybody has a bias against anybody that files a claim, and the trouble is they don't know it. If you're a member of the KKK, you don't like black people. If you're an Hamas, you're going to kill all the Jews and wipe them off the face, sir. You know that. But we all have that. When I started doing legal medicine, early 70s, I thought 60% of patients would be legitimate and the rest be flaky. That makes amongst normal doctors. Now, I probably shouldn't tell you this. This is a secret. To get into medical school, you have to be a registered Republican and a registered member of the Chamber of Commerce and screw a working man. Okay? Now, here I'm a bleeding heart Democrat. But no, I'm not. I just tell the truth. I don't care if hair lifts you. I don't care if hair lifts your boss. Jesus reads my reports, and the rest of you guys can just by walking. So, and now I'm just warning you, the scuttlebutt is, as we're talking to people, they're denying everything. Somewhere, some basement came up. We're going to start denying everything in federal workers' comp. Well, that's so you're going to have to go to somebody who knows what they're doing. And if they give up, go to someone with some balls. But more than that knows what to do. For instance, used to, I'd ask for an oral hearing. Oh, no, let me talk about it. Okay, now, if you do state workers' comp, you're going to do hearings, oral hearings. You make, and I also went to court for my patients. Okay. If you do personal injury, like car wrecks, you're going to either do video depositions or live depositions. If you're going to do federal workers' comp, then damn it, do it. That means you should ask for oral hearings. Go to them live if you need to. You need to be able to send something to ECAM, Employee Compensation Appeal Board. Otherwise, refer it to somebody that can. It doesn't hurt my feelings when you got a brain tumor and I have to send you a neurosurgeon. You do not want to do this legal stuff if you don't know it. You're hurting patients. Mercy tried to do it for 2 years. Wonderful hospital. Wonderful hospital. The whole system, fantastic. And their reports are a piece of crap. And they didn't know how to do a scheduled ward. At least they quit at 2 years. They got the guru down the street, assholes. But no one knows this. There is nobody out there doing federal workers' comp correctly. They're sending you 500 miles for physical therapy, doing this, doing that, not doing scheduled wards. If you're going to do it, do the whole comment or send it to somebody will. For instance, in Oklahoma City, I'm a Broadway clinic. Emily and Corey, the PA and the administrator, they know federal workers' comp. They take care of our postal people a lot. But now if they need a scheduled ward, we'll do them. And then I may say, I'm picking up carpal tunnel, and then they'll get that done because we can't do all that stuff. We work with you. I'm not in competition with you. We're trying to take care of the whole federal government. So send it to us, and we will do the scut work. Most hospitals in this city will not do federal workers' comp. McBride, and I'm using names, folks, where I had my wife's hips done. Great orthopedic group, won't do federal workers' comp. And their occupational medicine doctor, who was one of my residents when we had an occupational residency, let's talk to your board and do federal workers' comp. It's the biggest employer in Oklahoma, pays better than anyone else. Doesn't care. So, okay. Listen to me, my right guy. You can do this, but you have to have someone that knows how to do it. I guarantee you, if you're a hospital or a clinic, and I don't care how damn big you are, if you try to do this, you will be going to jail. Like everybody in Texas is in jail. Because if you learn the system, you can get on it and you get the right codes, the right diagnosis, or get the diagnosis. And then it's computer to computer. You're not going through a human being. And it pays better than anybody else. And you're going to get a CFO. Ooh, I can make a lot of money for us. And you'll start building stuff, and you'll start not documented. And it's the federal government, and you're going to jail. But if you document it, do it right, then that's what we need. It's all the government wants to do. Let's tell the truth and call it like it is. But no one's doing it. Okay, I'm sorry. But that's just the truth. Okay. So you're going to have a tough time from now on, but you're going to have someone that doesn't give up. So we do an oral hearing. Usually when I ask for an oral hearing, it takes about a week to 10 days to get it approved. Well, in the last year or so, it takes a couple days because finally, if I ask for an oral hearing, that's where we're going to talk to somebody at a higher level. The claims examiner opens the file, and they're swamped. They can't do all this stuff. And then the oral, and they say, you don't need an oral hearing. Those things you requested, diagnosis, surgery, whatever, a test, I'm approving. Okay, but now we found an even better way. Slip and fall, see in the emergency room, neck is strained neck, and a contused elbow are approved. This will never amount to any kind of, maybe a few days time off. It'll never amount to a permanent injury. But he's got a couple of days off. He'd like to get paid for that. And so he sends a letter in. I'd like these 4 contusions approved. And the claim examiner, who's supposed to respond in 30 days, ignores it. Now, if an insurance company did that, you get $40,000, never even go to court, just to keep you out of court. Called bad faith. Punitive damages. But you don't even need to know your claim examiner name. They only need a 12th grade education. No training in medicine, no training in law. And they have a bias. They just don't know it. Sometimes you'll pick it up real quick. All right. So we helped him. And in federal, you get to see what the government has on you. You get online, it's called eComp, and you can see what they've got, to see if they got the doctor's report, see if they got the MRI, and you can send stuff in, send information in. It's all there, open between you and the government. No, they can't hide stuff from you. So he sent a letter in. On this date, I requested an upgrade to these 4 conditions. You ignored it at the 30-day deadline. He put in there, you have to reply in 30 days. This is the third and final time. If you do not file it by make a response, even a denial, by this date, then I'm going to request an oral hearing for this to be reviewed by a senior claims examiner. You don't have to do that. You can ask for that. Well, that was on January 11th this year. On January 12th, the claims examiner said, pull up your file, and those 4 conditions are approved. Okay, so at least they have to look at the file. It just get them to look at the file. I can't know how these guys and gals do it. They're swamped. This is legal medicine, complicated, all kinds of stuff. And it's online, not categorized. I've got a staff that separates everything out, actually puts the MRI results, the op report, and it puts it in my lap. My God, how's the claims examiner do it? God bless you, CEs. All right. So it's going to be worse. All right. Now, here is a VA. They played my speech discrimination test at 80 decibels in order for me to make out the words. That's probably, they can go up to 70 decibels. But the big fraud in VA disability, I had patient hearing aids, yell, he can't hear, cover my mouth, and if you can't read my lips, you can't understand. Anyway, and he would be 40, 50% under a book like the American Medical Association Guides for Evaluating Impairment. But under the VA, he got 0 because he has the audiogram, but he understood 96% of the words, which is outright fraud. First of all, normal people don't make 96%. Okay? And so what was happening, the audiologist kept saying the words and repeating the words and didn't use the Maryland CNC, which is a CD-ROM, but you turn these people over to OIG. And we need to do that some audiologists someday. Okay. So they come back with 0. All right. But the other bad thing they'll do, you'll have a dip in the high frequency, and then instead of writing it 0, they'll deny the hearing loss. Now, if you got a 4,000 dip, that's noise. It's not old age. People in the middle of Africa, people in the middle of Australia that have never seen a truck or lawnmower, old men don't get hearing loss unless it's a bone disease. Otosclerosis. Okay. All right. So repeat the test, but you need to make sure you get a 0, not a denial. Now, you should be getting 10% for tinnitus. Now, I was talking to a guy the other day. Do you have tinnitus? No, but I have a lot of humming. Well, that's tinnitus. You're the So anyway, and that's 10%. It's very important to have that because you have tinnitus that contributes to sleep apnea. It contributes to heart attacks and strokes, and the widow can get a pension. Okay. Here is Leander. A couple incidents where this, I must be military. Acute hearing loss due to machine gun fire without hearing protection. Always wear hearing protection on helicopters and around jet engines. I have tinnitus in my left ear only. That's not uncommon. However, my audiogram is always good. In fact, it actually improved in several years in a row. Yes, it will. Depends how you feel that day and how much fluid you have. It's going to. Okay. It's the audiogram that shows the noise-induced hearing loss. Tinnitus may have nothing to do with noise exposure. It could be genetic or do something else. No. Okay, let's say you have a genetic tinnitus. You're around machine guns, it's going to aggravate it. Now, in federal and VA disability, if it aggravates it that much, it's 100% covered. Now, in state work comp like here, it's got to be 50% to make it work-related. Criminal law, it's got to be beyond a shadow of doubt. But no one knows the law, and then you add on that the bigotry against people who file claims, everybody gets turned down. Okay, the providers, this is a comment from Maria. Okay, the providers at the VA hospital are not trained to help you with the claims. Absolutely. No one's trained to help you with the claims. No doctor, and veteran service officers are trained to help you fill out the stuff. But they do not ask for a nexus report for a doctor to put the medical rationale and put the history and look up the codes and put that together. Because we're not trained in legal medicine and just don't know shit from Shinola about VA or federal. So it's gonna be hard. So don't ask your family doctor to do it. Don't ask your audiologist to do it. Don't ask a neurosurgeon to do it. You need somebody that's an expert in occupational legal medicine. Okay. And then an expert in federal or expert in VA. So don't even ask them. It's not fair. Also, they know that if they start finding things with you, there's going to be somebody around there that's not going to like it. I have a guy who does VA exams for one of there are 3 companies that the VA farms out VA exams to. Most of the people that do it are honest. But he gets letters saying, you're finding a lot of extra stuff than what we asked for. Wow. That's not even a threat. That means if you keep doing it, we're not going to send you business. Now, an insurance company, absolutely. Stop finding stuff we don't want over and stop paying you. But this is supposed to be the VA, the good guys. The truth, justice, American way. It's the bias. Okay. They're there to treat, do not have time to training to send you. That's true. A VA employee to work in rehab. I learned this hard way in my own class. Of course, everybody does. All those pins in the map, if you go to ellisclaim.com, have a horror story of something in the government, usually. It's the bias, and they don't know they have it. Okay, here's Erica. My doctor wants to be paid to complete a medical narrative. I'm putting in e-comp of the doctor's request. It's been April, no reply. You're never going to get a reply. Claimants have said you get that your doctor has to get a provider number. They have to submit it, and then they charge an office visit and they do it. But if your doctor doesn't know how to do that, don't even have to do it to begin with. If he's asking you to get him approved, probably doesn't know how to do a good report anyway. And if he's too arrogant, or she's too arrogant to send somebody to do the scut work for him, get out of there. Now we'll take his records and use them, what he's found in the normal course of medicine. Right? Here's interesting. We always have an AI answer. This time AI missed it. Once it said put in the e-comp, that means it's federal. AI said medical narratives, DBQs, that's VA. And opinion statements, okay, it's VA. That's the VA AI. Okay. Okay, it's Leander. I would see you in March of 2025. Got an exit letter and just got my 100%. Oh, good. Including sleep apnea, heart disease. Still waiting for the stuff to be adjudicated. Thanks for all your help. Oh, he's just saying nice things. Okay. Was denied 3 times before because they didn't have a nexus letter. A doctor talking. Had a rater out of St. Louis. Oh, doctor, you're so wonderful. You give us a nice short history. You look up the codes in the big thick book, and it just makes it easy. And your causation, your nexus, makes sense. We wish other people like you. I said, lady, don't say it out loud. They'll fire you. I had a rater out at Muskogee just recently. Now, the Muskogee's kind of middle of the road. Anyway, she brought her husband in because she knows my reports. Now, Waco, I'm just telling you, you guys are crooks. You fight things that shouldn't be fought. I need to come down and teach you that you got a bias so we can get over it. Okay. Okay, this is Kyle. God bless you. He does. And Charles, great job. Love the training. Great. Thank you. Robert, yeah, Dr. Ellis, Nexus Letters Connection. That's it. Okay. Michael, keep kicking ass, Doc. God, I love kicking ass. Jesus. I gotta show you this. Okay. This beautiful lady, my wife, said, you're getting paid to be an asshole. I said, honey, I'm getting paid to teach it. Okay. This is Charles, workers' comp. In 2023, I received rating 26% for each knee, 58% for the lower extremities. A year later, I received 14% rating for each foot, totaling 28. I was denied a schedule award for the test because the 28 was less than 52%. They need to combine it all together. Your doctor needs to put the knee and the foot together. It's the leg. It's not a knee. It's the whole leg. For instance, federal is so fair. You're born with a club foot, have a high school basketball knee surgery, you're a Marines, you have a knee surgery, you have a car wreck, you have knee surgery, and you work for the government to get a strain. The way you rate the knee is the total knee. I don't apportion it like anything else. So much to this. And I had the club foot. So have someone look at it. Send it to us. We'll look at it, see if it's worthwhile doing a report for you. That's called a scheduled award. David, Texas, work comp. I'm injured federal worker as patient of Ellis Clinic's 3 areas considered for scheduled awards. He's got shoulder replacement, lumbar fusion, surgery, nerve damage, asking for replacement for knee surgery. How will this situation proceed? Okay, now, if they're all under one claim, you're stuck. But if you file them under separate claims, we could maybe do your shoulder while you're getting something for your back. But if you're, because you're still getting treatment or if you're off work, do say your back, you don't want to schedule work. It'll cut off your checks. But if they're separate, then we can say you can do a schedule order on these. Okay. Anything else out there?
Yeah, we have a few here online. Let's start. Well, Jack Trades 1067. Well, start for that. Scott did us says happy birthday. Jack Trades 1067. I'm in the middle of a TDIU claim on COPD right now. Then Leander Savoy. Thanks, doctor. Your clinic is awesome. Staff is the very best. Thanks again.
Let me interrupt. What's a TDIU? TDIU claim.
Temporary disability individual unemployed.
Oh, okay. VA. Yeah. Okay. Gotcha. Well, you definitely need a doctor's report on that.
Is George Ortiz. I saw you for schedule award. Then DLL sent me a second opinion. Now DLL mentioned a referee.
Yeah, they do that all the time.
What's the process?
Okay, the process. First of all, she wants to get it offer, so she'll send you a second opinion, and if the second opinion is too different than my opinion, then they'll send you a referee, and then whatever. Then you finally get a schedule award, whatever it is. But that's not the end. It never ends. You can always go back. As you get worse, you just do another schedule award. You have to wait a year. And you file again, you file again.
So basically,
yeah, the law's on your side, folks.
Oh,
but your doctors and lawyers don't know this stuff either.
We have 27J Taco. Hello, sir. I had back surgery tonight because a second opinion said I didn't need it. I have an appointment with the surgeon for an updated report so I can appeal it and reconsider. Is this a good thing? Well,
if your surgeon's got his head out of his ass, but he's not trained in that. Okay? Your surgeon calls you a liar that you don't hurt, you don't need. Yeah, but you may or may, he may agree. I may agree with you. You don't want to do surgery, but you still got it back, and he doesn't understand causation in federal workers' comp and VA. You're 80 years old and your back's bad. Everybody's back at age bad. But if employment factors or work in the service factor, or if you got a stub toe and you have a little bit of limp, then that makes it work related. And doctors not trained that way.
All right. We have Daniel Risk here. Alice, I hope you're doing well. I'm reaching out to request your assistance and guidance regarding issue I am experiencing with my workers' compensation claim. As a federal employee located in California, I'm attempting to change my treating physician to Dr. Ellis in Oklahoma. According to the information on Dr. Ellis, injured employee may request a change of position at any time. My request is based on medical necessity. I have been diagnosed with CRPS type 1 and still require ongoing treatment. My current treating physician placed me on maximum medical improvement, MMI, on July 28, 2025, and subsequently released me from her care. Despite this, I continue to experience symptoms and need continued treatment. Because I no longer have an active treating provider, it is important for me to transition to a physician with the appropriate expertise. However, my claims examiner is pushing back and has stated that I will not be allowed to see Dr. Ellis. I'm unsure what procedural steps I should take next to secure appropriate care and ensure my right to select a qualified treating physician is upheld. Could you please advise me on how to proceed? Any guidance on the required steps, documentation, or forms necessary to request a change in treating physician under the federal workers' compensation process would be greatly appreciated. Thank you in advance for your time and support. I look forward to your direction. Warm regards, Daniel Riss.
Folks, I am really, really pissed off. I'm so old, I used to treat reflex sympathetic dystrophy, RSD, now complex regional pain syndrome. That doesn't go away. It may come and go, but if you have any symptoms, you need to be getting, if it's an arm or in the autonomic nervous system, just plain old Novocaine or Marcaine long acting, you need to get that over and over and over to block it. It works, and you will never be stopped treatment. So I don't know what they were treating you with before, but if they were not giving you those injections, they're not like steroids, okay, then she's incompetent, okay? And you've got to continue. But you don't need me to be your doctor. You need to be your consultant. You have your doctor send it, like go back and said, I want to do some more shots. And the claims examiner says, no. Where's your damn medical degree, bitch? Or doctors say no. A doctor says no to complex regional pain syndrome. You find a lawyer, and I'll testify for $1 that that's goddamn malpractice. Here's a case. Okay, sheetrock. This state workers' comp. Sheetrock on the hand, hurts a couple days. The pain goes away. No broken bones, no nothing. Then he gets hurting. And I didn't see him with you initially. I see him 6 months later. His fingernails are not cut. He has no hair, and his arm looks like he's a porcelain doll. Major complex regional pain syndrome. Can't wear a shirt. Okay. So, and his attorney is a respondent attorney for the insurance companies, but it's taking him as a plaintiff. The goddamn son of a bitch. And these are right words. If you don't want me to cuss, stop putting these people in the ovens. I said he needs an injection here. Get paid for it in cash. Do your health insurance. They piddle fart around and it sets. And finally, I go to court and I get a patch, a flat X-ray of two hands, and you can see from 500 feet away the difference. And so he finally starts getting the shots. And then there are two ways in federal work and state workers comp you can settle a case. Joint petition means here's your money, and then it's no more treatment. Can't open it. It's dead. That doesn't happen federal, doesn't happen VA, so you can always reopen it. Or an order where it gives continued treatment. And that son of a bitch comes into my office and brags that he got a joint petition. And I almost came across the desk and kicked him in the balls. I said, you son of a bitch, charge this thing. Where do you see that I said he doesn't need more treatment? And you had the audacity to come in here. Don't you ever send me another patient. This guy's ruined for life because of a stupid son of a bitch attorney. But your pain doctor released you. No, you get another pain doctor, and I'll help them get paid or do it on your health insurance. But you need those injections. Now, their book says once it's set, you can never do it. No, I've had people with maybe a year or two injections get better. And now the autonomic nervous system. I'm moving my finger, my brain's sending a nerve down this. And okay, now, so when you get butterflies in your stomach, you're doing speech, or if you play with snowball and you wash your hands and you have that burning, the blood vessels, blushing, that's the autonomic nervous system. Well, heart beats fast. Okay, it's the autonomic nervous system. Or does it get hard on? It's the autonomic nervous system. Okay, but you block it. It's not in the spine. It's out. It's a little thing beside the spine. and the doctor just puts some Novocaine on it. And if it helps, that gives you even diagnosis. Also now, and now if you have complex treated pain syndrome, you're gonna have a huge amount of impairment if it's federal work comp. Think we're through?
No, that is something else, man.
Well, no, come on.
Well, it is.
Yeah, I mean,
these
come on.
claims provider, these
Yeah.
claims examiners thinking that they are
Practicing medicine.
Well,
But now on federal, now if you go to Veterans Appeals and just Google the word Ellis, the judges at the Veterans Appeals in Washington, D.C. are lawyers. They know the law. They know it's pro-veteran. They're not biased at all. They're just clear, honest people. And every time I've done an oral hearing, either by phone or video or live, they're interested in the truth. They're honest. So I need to tell you my oral hearing in Amarillo, because this is a classic case. And okay, so Charles has been a mail handler in the mail post office in Amarillo for 100 years. And we've done neck, back surgery, carpal tunnel, cubital tunnel, charge about this thing. The Employee Compensation Appeal Board, which is the Supreme Court and Federal Workers' Comp, the judges are very honest. Just wow, which all judges are like that. Anyway, they said do not do videos. Post office does them all the time still, because they said they may be on medicine. It's not their job. Videos are not medical evidence. Okay, post office does it to intimidate you. Okay, and it's just fraud, and you're wasting a lot of money. So anyway, they get a video. Charles lifts some bags up. Groceries. It takes him and his daughter, 30, 40 feet. They got videos on this guy. They're spending my tax dollars investigating this guy with a chart this damn thick. And is he able to work? First of all, a video doesn't tell that. I tell that. And in federal, your doctor makes all decisions on return to work and restrictions. You can have a second opinion, but if I don't have a degree, I still win. And because that's what the law is.
Oh.
So anyway, I get a call from the union guy. They're going to have an oral hearing. I said, sounds like I need to come. How much for 2 days? $20,000. I come for free. Buy me lunch. So I get out there and I got this wonderful judge. Oh my God, that big with black, smarter than spit. I mean, just wow. Now University of Texas law professor. I'll bet her federal courtroom was awesome. Anyway. So she's sitting there. Now, it's all her life. She's seen ambulance chase attorneys bring doctors in, say they're 100% impaired. The sky is falling. The sky is falling. And then insurance company doctors, they're better from the accident. Both of them just lying whores. Okay. So she's sitting there and assumes I'm that lying whore, which she should. If you're going to do legal medicine, people are not going to like you. If you spell God, They, you're worried what they think instead of what he thinks. Don't do this. So anyway, Dr. Ellis, what are you getting paid? You can tell by the body language, inflection of voice. Anyway, now if this is federal court, I would not have responded the way I did. I go, I got a good steak last night, just being flippant. No, don't you be flippant with me. Well, obviously, she doesn't know the law. In an oral hearing, you don't even have to keep a record. We had a stenographer there, but you don't need to. It's informal. Let's try to get this thing done. So if I don't take over, Charles is going to jail after all these years from government. Now, you need to understand why they're coming after him. If you're a prosecuting attorney, I assume you have to have so many scalps for your belt every year. You're not coming after drug cartels. They'll kill your kids. And everybody says, we're hurting these poor immigrants. How dumb is that? We invited drug cartels in America. And someone wants to defend that. There's going to be a lot of scatter. There's going to be some honest people get screwed together. Because you let the scumbags in, then everybody's going to get hurt. And so anyway, enough of politics. Okay. So what do you do? What book do you read? what class do you take? What medical school or law school do you go to? There ain't one. I'm the guy. If you don't come in and learn from me before I die, you're stupid. So anyway, here I used to say Marcus Welby, then I realized at my age, no one knows who I'm talking about because he was a family doctor on TV when it was black and white. Okay, so here I sit there and I look at her and I look at her and I look at her. And I slowly get up, walk around, get in her face where I'm that far from her. Ma'am, I am a clinical associate professor of legal medicine. I am a professor of occupational environmental medicine. I've taken off 2 days. My wife is at home with the moving vans. I paid all my expenses. I did get steak last night, and they're damn sure going to buy me some beers tonight. And I'm going to teach you the law because I'm the world's leading expert on the Federal Employment Compensation Act. And you don't know it. By your body language inflection, I'll bet you $1,000 a dollar you've not read that law. And you're way over your head. And I'm going to teach you ethics. You don't need to teach me. And boy, you guys, because the union guys, oh God, bipolar, oh my God, it's crazy, it's crazy, it's crazy. It's prefrontal cortex and show business. People are 96% the same DNA as a chimpanzee. So that's our flesh. We're going to act like primates. If you ever had a 2-year-old, you understand that. Okay. So anyway, and of course she correctly is upset, and then she goes, very intelligent lady, goes, tell me what you think. Of course, then I lit into the supervisor and the lawyer and just ate for lunch, and she said that of course I left. They said that she pointed to him, said, you settled this for lunch. You don't want my opinion. She still raked him over the coals. So I assume Amarillo thinks I'm the Antichrist, and of course that'll be mythology when I die. Their doctor's not trained in that, and they're not, even if they are. No doctor's going to put its license on the line for you. I'm sorry, but he's not going to, or she's not going to do it. I just like doing it. I like being on races. I love Vietnam. I love the mortars coming in. I love the camaraderie, the crap, and I hate it. Not 50-50. I love war. I love kicking ass. I may be just Don Quixote or fighting windmills, but that's okay. And I hated it 100%. It's like the Bible is a dialectic. It's 100% predestination and simultaneously free will. There's no way the human mind can understand that. The spirit can. Okay. So doctors, you don't have to come take a class. Just refer them to us. My staff knows more than I do. I've got the greatest staff ever. I mean, my God, I don't know why they put it with me. No question, I'm the number one asshole. So Ken Edwards said. I love that. Okay. So anything else?
Yes.
We through?
No.
Okay.
All right. We've got Candyman 54. I am a 73-year-old male, Navy veteran. I'm getting 10% for tinnitus and 50% for PTSD. I have diagnosed sleep apnea, artery stent, glaucoma, ED, Peyronie's, vet rated. There we go. Do you need all medical records or only relevant to claims? File all at once or get sleep apnea first? This is a great question.
Great question. Okay. Send them all. And then, you put 12, I said it's going to take several visits. But now, your tinnitus is going to get you sleep apnea. Okay. Your PTSD is going to get sleep. But put it all there. Now, glaucoma, I may not agree to. So I may say, and then we'll say, well, okay, we'll do this, but I'm not going to do this one. But that doesn't mean you can't find a case law or a doctor that will. But now I may. It depends. Okay, and then we'll look at it. In fact, I've got a call waiting for someone who said, "What if I do a whole bunch?" I said, "Well, send it first. I'm not going to talk to you on the phone. I'm not put your brain up to the phone, and then we'll look at them and see what to do. But certainly we can, especially if you're poor, because he wanted to do one as the money came in." But a lot of times someone comes in, I'll do what you didn't know. I'm going to. You got this, and then we'll send you a master, mark through it. You can't use it, and you pay them as you go. But I can't give you a full day for $500, but I can give you 3 or 4 for $500. I can't set aside a whole day if you're so poor that that you can't get here. But you send it in, we'll look at you, give you a call. And if your friend is having problems, give us a call. My staff's a bunch of bleeding hearts. They'll take care of you. They love you. Okay.
Ron Jackson on Facebook says, "You're a great doctor. I appreciate everything you've done for me."
Well, good.
Good. So,
I've done more good for my fellow man than when I was delivering babies doing surgery. This is what God's called me to be. You're an asshole.
So 27J Taco, who on YouTube commented about him being denied the back surgery and having an appointment with the surgeon for an updated report, he followed up. So who do I go to? Because my treating physician also made a rebuttal against the second opinion. I'm on TTD and need of a surgery.
Having to do a consult, we'll do with that stuff. We'll do a telephone, and then we'll ask for oral hearing, and let me talk to the oral hearing officer. The doctors don't need to do.
What's the process? He just
you fill out a pro. You get your the doc. You fill it out, and you get a letter from your doctor. I'm requesting a consult. I need something in writing. So then when I write it, Dr. Joe, it's asked for a consult. And so you're the claims examiner and you're reading this. And we already know this doctor is asking that doctor a consult, and the consult's a higher level. And so maybe they'll pay attention. But they're swamped. It may not be the bias, it's just they're swamped.
Right.
Because, see, I'm only seeing the ones having trouble. So that's not fair to knock all claims examiners.
All right, we have Leander's Avoy 1450 on YouTube commenting, "Do not ever give up. Get a Nexus report from Ellis Clinic. It works as long as you don't quit."
That's it. You got to have skin in the game. Don't quit. And you get to continue your trying in federal, and you get to continue trying in the workers' comp. State workers' comp, not so much. If you got a joint petition, it's over. But in federal, it never ends.
All right. We have another here from Rolando Almendarez Sr. I was injured in 12/23, and I'm on periodic roll. But I was sent to their doctor in a second opinion, and back to the first doctor, and they agreed to have surgery. But I want to schedule a ward and not surgery on my back, and I have nerve damage and radiculopathy. How do I get to be at an MMI and proceed to schedule a ward?
Okay, that's right. Now, MMI, max medical improvement. Since you don't want surgery, you are at MMI. Now we're treating you, we'd be giving you shots, but that's maintenance. We had a classic case a couple months ago. The doctor had done 5 knee surgeries under federal works comp. He's a provider. He bills the government. The guy didn't have to pay copay. And the last one was a total knee replacement. And I said, when will I be I asked the doctor, when will I be at max medical improvement? The doctor correctly said, with the training we have. Well, never. You're always going to need shots. You're going to need physical therapy. You're always going to have problems, which is true. But under the federal workers' comp law, it's not going to make a difference in the outcome. So you are ready for scheduled ward. And he came in here and got $310,000 for his knee replacement. Otherwise, that doctor would have cost him $310,000 and all the interest he could use right now. So doctor, say, I don't know, call W Ellis. And I won't do knee surgery. I won't do knee replacements. And you don't practice legal medicine unless you're trained. But also, you ask AI, they'll tell you. Except for this one here, that's pretty good stuff.
All right. We have Candyman54. Thanks, Doc, for answering my questions. We have George Ortiz here. I'm waiting on scheduled award, but my condition is getting to the point where I can't perform my duties. Can I go on disability even if I am 50 years old and eligible for retirement?
If you're federal, yes. But actually, if you can do no gainful employment, you're Social Security eligible. But in federal, you can take federal employment retirement system and retire early. The classic case I use all the time, Texarkana Army Depot, guy's got a fuse neck, he runs a crane. Well, he can't do that. He's not Social Security eligible. So he gets FERS, okay? And he's on FERS. It's a slam dunk case. But now it's no longer a slam dunk case. It used to be. The FERS law is very, very fair. You can't do the job for which you were hired. And then there's just somebody in some basement somewhere decided the Boyer retirement system said, we're going to fight them all. And one of them, they sent a letter to the doctor, who's treating doctor. Now, this is a template that I produced with these magic words. The magic words for Social Security on this side, magic word for FERS on this side, okay? They sent the doctor those questions. Since it was a federal, he was afraid to fill it out. But they denied my report because I'm not the treating doctor. If I had a law firm, we'd go after that person big time. That is fraud. Cite that reference. That's not a reference. Also, since I'm not only occupational legal medicine and a fellow and a professor of occupational legal medicine, then I worked with vocational rehab and stuff. I'm more qualified than any damn orthopedic surgeon in the world with my background in occupational medicine. Not qualified to do knee surgeries, but by golly, I know how when and what to get back to work. I worked with vocational rehab people all the time. Got to tell you a great rehab story about us guys. Old roughneck, old file. He's got a bad whatever, probably back or knee. Anyway, totally despondent. Anyway, so Kerry Bartlaw is vocational rehab specialist, and of course, and the insurance company's fighting him. He's done lost his stock, and lost his family, blah blah blah. And Kerry said, if he can come up with $750, I will do a half of a vocational rehab. Okay. Which is usually a 2-day test. I do a 1-day test. Well, he family shifts in. He comes in next month. Hey, Doc, how you doing? Slapping hands, smiling down. I'm going to be a computer specialist. Blah, blah, blah. Look at me. I have worth. I'm a man. I have worth. Someone needs me. You know he's going back to old fields. But that was the most therapeutic thing I've ever done in psychology, except maybe this map. You come in and go, I'm not paranoid. They really are out to get me. And they really are, folks. Consider if you're in federal works job or VA that you're in Russia and China. That's how they treat you. You pick up those fives. It's like being a black man in a KKK meeting in 1935. It's that bad. If the people don't understand this stuff.
Sad. So Daniel Risk follows up. So is there a way to rebuttal the claims examiner for not letting me see you? Because I'm in California and they're saying you're in Oklahoma. Thanks.
Yes. You can file Bivens, Bivens. Print it out, send it to the claims examiner. If you don't but you don't want me to do that. You just want me to be a consultant. Okay. Now let me explain legal medicine. Bivens in 1971 or 77. Anyway, 5 officers, federal officers, denied the constitutional rights of a federal employee. He sued them. They had to pay their own attorney fees and court costs. So federal employees, especially prosecuting attorneys, you are the lowest on the totem pole. You have to behave. In 2005, I started saying, my taxes pay your salary. You better know this shit or I'm going to kick your ass. And I've been kicking it. I've done 1,509 trials and depositions. My testimony's never lost a case. Every time I've been to federal criminal court, the judge has threatened prosecuting attorneys with contempt and sometimes even jail. And in federal, you're supposed to provide the last 4 years of trial testimony. I give it all. They don't even have a clerk look at it. If you'd read one of those transcripts, you wouldn't let this asshole in the courtroom. Because I don't help things, calling myself a hick doctor. You really believe that? So now, it's the duck. Now the duck is, we want to get something done. What's the best way? Get your doctor, send me a letter referring, and I'll write the report and then you send it in to ecom. Or we'll even help you send it to ecom for you. I mean, it'll be your ecom, but you do, yeah. But we'll show you, if you don't know how to do ecom, we'll show you start a file and you send it in. And then if they don't, then you ask for an oral hearing. I'll ask for oral hearing, your doctor had to do that. And they go, well, yeah, okay. Because they're not going to, because they're going to look at the file. We're just trying to get them to look at the file.
All right, we have here David Parker Thomas 2375 on YouTube. David, South Carolina, you addressed my question earlier. I had one accident that affected shoulder, low back, and knee. All had surgery. I figured that I might be eligible for 3 scheduled awards. How can I get that done?
Well, we'll find someone to do a scheduled award for you.
What's the talk about the process? Not
okay. Now, I've got another form. Well, no, this form right here, you say, I want a scheduled award. You know, an appointment for federal. I want a scheduled award. We'll look at it. And because maybe you should be on workers' comp, but we'll do scheduled awards. That's what we do. We go, yeah. And I'm not going to brag. I'm just telling the fact. I'll get that book out. This is the 6th edition of the AMA Guides. Came out in 2009, and I went ballistic. I put all this stuff, all this PowerPoint stuff, how it's lowered the 5th edition to, 40% less than the 5th edition. Well, January this year, the Department of Labor came out and said injured federal employees have lost $1 billion, $900 million going from the 5th to this. And this guy does work just for insurance companies, AMA. You have sold your soul, you dumb shits. Now, no one's going to talk to me, but I was right because I'm always right. But anyway, in this book, I go to the seminar, put by the authors. They're still doing it. And they give an example. You have a shoulder surgery, rotator cuff tear, labrum tear, biceps tendon tear. It says you can only rate 1. Hey, Brigham, you're a goddamn whore for the insurance companies. And he is. That's all he does. And you can say the same thing about me. I do almost 98% of stuff I do is for plaintiffs. You call me a whore for the plaintiffs, I'll accept that. All right. I have to go back to Oklahoma and tell our workers' comp judges to use this new book. So if I have triplets, one has 1 surgery, one has 2, one has 3, I can only rate 1 in each one of them. Well, Feasible in 17.6, Federal Employment Compensation Act building says you do all 3, which is common sense. See? But if you don't know that, and you do a schedule or you just do 1, you just screwed your patient. So you need to know somebody who knows the whole gamut.
Well, no, it's you touched on this, and while we're waiting for some additional comments, well, actually, it's almost 12 o'clock now. Wow,
it's time to quit
fast. But it's before we move out for the day. So if you have any other questions, please put them in chat before we close out. Is you talked about medical records specifically, but I think there's one important distinction for medical records, especially for veterans.
Yeah, good. Thanks. Thank you. Thank you so much. You're just a gold mine. Miles Raymond and Gary here. I've not even checked their ID because they're probably angels, and I don't want to find out. Okay, now, do not wait for get your medical records to file for VA. Just file it. Come in, I'll do a nexus report, and let them find the records for you. Let them, the best records are the ones that burned up in St. Louis. But you come in, you tell me your history. That's your new medical record. Don't wait. Every day you wait, you could be making interest on that money. Okay? You could be dead. As soon as you finally get it, you're dead, that the government's trying to help us here, file it. Come in, and then we will get records. Okay? That's what, just so file it. And my report is a medical record. And none of us have records in the service, especially Marines and paratroopers. They're not going to medics. They're going to be on KP. No. You look, and also back then you had more testosterone in Marines. But you're looked bad on if you get hurt on the job in federal workers' comp. Look bad on you get hurt on the job in the military, and it's a bias. And some son of a bitch. Well, I don't think you're hurt until you do a physical exam and you know legal medicine. Kiss my ass. Who the hell do you think you are saying someone's not injured? God can tell me, but you can't.
We have a comment from David Parker Thomas 2375 on YouTube. So 3 schedule awards get grouped into one question?
No, there may be 3 claims. If it's all on the same claim, it's extremities. We'll do 3 extremities, 4 extremities. All right.
Well,
And it may be 1 report. It may be 3 reports.
Well, since we're coming to 12 o'clock here, is if you have any questions for next month and next year, we'll be back on the first Friday at 11 a.m. You can go to AskDocEllis.com. Doc, do you have any final comments?
Jesus is real. He really came. He's really raised. And he wants to be in you and lead you. He wants to put his heart, his spirit in you and tell you what to do. You don't let anybody else tell you what to do. The Holy Spirit does. There's more in the Old Testament about the infilling of the Spirit of Jesus than the resurrection. John the Baptist is in the dungeon getting ready to have his head cut off. He's having some doubts, like we all do. Sends words to the disciples. Are you the one? We miss out on this. And he said, you don't tell John the good news, preach the poor, dead are raised. Then he said, of those born among women, that's Moses, Elijah, Jeremiah, Elisha, John the Baptist is the greatest physical man today. He's depressed. He's pissed. His theology sucks. He still is the greatest person ever born. Okay. Then he said, he who's least in the kingdom of heaven is greater than any of these. And most people do not know. They hope to go to heaven. You've got to know. This is what I've written that you may know. You have the Son have life, he doesn't have life. It's not whether you're good or bad, because I'm the number 1 asshole. I'm still going to heaven.
It's on your mug.
It's on my mug. Problem, yeah. So, but people are your confidence, and most people, Christians I know, are not. Most Christians don't know they're saints. So Corinthians are doing flesh sin. Jimmy Swagger, Bill Clinton stuff. See, suing each other at temple prostitutes. Really, easy to see. And he says, to the saints at Corinth, quit it. You're going to heaven. Not Christmas. You better watch out. You better not pout or you won't get your Christmas present. That's earning. Like we were taught, learn to be good, not to be spanked. Learn to be good to get a reward. Then women, my God, help them. They've got to learn makeup and how to dress and do all this other stuff to be loved. And yet they're quicker to understand grace. Well, they got an extra chromosome.
Right.
So the Holy Spirit in you, he's in everyone here, these 3 guys. The amount of the Holy Spirit came in me when I was saved is 100%. If you're saved, that's 100%. The amount of faith I received, that's the other lie of Satan. If you ever tell you a church to have faith, that's a lie. The amount of faith that came in my heart is 100%. Mustard seed moves the mountain. You say it.
All right. Well, with that, we will see you next month. Thanks for joining us.